They give you an infant with cleft lip and palate. Before we even go here, what's the etiology? What causes cleft lip and palate? If I asked you that, what would you say? But that's a common MBME question. What causes cleft lip and palate? Is there any specific thing you would want to say causes it?
No, it's not.
What's the best way to answer this?
Lithium?
It's multifactorial.
Oh, yeah, I see that question.
You have seen questions like this. Very good. Cleft lip and palate, the etiology is multifactorial. Okay, but what if they give you a person with cleft lip and palate, microcephaly, holoprosencephaly, cutis aplasia? What would you pick? What would you diagnose the person with?
This is Edward.
What did you call it? It's what?
No, Patau. Sorry, Patau.
Okay, this will be Patau syndrome. What's the chromosomal abnormality? What trisomy is Patau?
13.
Trisomy 13. What disease is trisomy 18?
Edward.
Edward syndrome. Edward syndrome will be trisomy 18. And of course, Down syndrome is 21, right?
Yeah.
All right, we talked about cutis aplasia. Do you remember the medication that causes cutis aplasia congenita if the mother is using it? A medication, an endocrinology medication that would cause cutis aplasia congenita if the mother is using it. It's an endocrine medication.
I don't remember.
All right, that would be metimazole. Metimazole, right? That would be one of the side effects of metimazole, cutis aplasia congenita. Cutis aplasia congenita. Do you get that?
Yeah.
Metimazole. What was the mechanism of action of metimazole? And what did we use metimazole to do to start with?
Well, we use for hyperthyroidism.
For hyperthyroidism, metimazole works by inhibiting what enzyme?
Metimazole block the thyroid peroxidase.
They inhibit thyroid peroxidase.
The oxidation.
What's the other medication that also inhibits thyroid peroxidase?
The other they have the same action. Mechanism action is the other one that they use propionuracil.
Propylthiouracil. PTU, right?
Yeah.
But propylthiouracil has additional side effects or additional mechanism rather. You remember that propylthiouracil inhibits peripheral conversion of T4 to T3. What enzyme was it propylthiouracil inhibiting? You remember 5' deiodinase. 5' deiodinase. And these medications can produce or cause a granulocytosis. Right?
Yeah.
A granulocytosis, hepatotoxicity. So in pregnancy, especially in early pregnancy, you want to avoid metimazole, right? Especially within those first trimester, second trimester, week 3 to 8, basically. First trimester, right? All righty. Then I was going to ask you a question. There's an antibiotic medication that inhibits 50S ribosomal subunit. This medication causes dose-dependent anemia and non-dose dependent anemia and non-dose dependent aplastic anemia.
Mm,
Do you remember this medication?
oops, oops,
I wanted to give you one more side effect, but I think that would be obvious. It causes gray baby syndrome.
Oh, it's a fluoroquinolone. Fluoroquinolone.
It's not a fluoroquinolone. It's a medication by itself. What would that medication be? It's a medication that just stands alone. It binds. It binds 50S ribosomal subunit. It causes dose-dependent anemia as a side effect. These are all side effects. Non-dose dependent aplastic anemia. Yes, tell me. Chloramphenicol, right?
I overthink it. Okay. Yeah.
All right. That would be chloramphenicol. And we want to remember that chloramphenicol binds 50S ribosomal subunit and inhibits peptidyl transferase. It blocks peptidyl transferase. Okay. Basically, almost the same thing as your clindamycin and macrolides, right? Very similar to your clindamycin and macrolides. Binds 50S ribosomal subunit, inhibits peptidyl. If they give you an infant with hypoglycemia and hepatomegaly, mild hepatomegaly, I would add, an infant with hypoglycemia and mild hepatomegaly, what would you diagnose this child with?
There is my on here.
Okay, von Gerth disease. Is von Gerth disease
Okay.
mild? Does von Gerth disease cause mild hepatomegaly? What's the milder version of von Gerth in terms of presentation? Exercise intolerance and liver. Cory's disease.
Sorry, what? Disease.
Right? Cory's disease is the one with the mild hepatomegaly. Von Gerth disease is the one with the more severe hepatomegaly. These are people that also have lactic acidosis, hyperuricemia, right? Additional symptoms. What enzyme was deficient in Cory's disease?
This is the branches enzyme.
Branching enzyme. The branching enzyme. What enzyme was deficient in von Gerth's disease?
Glucose
Glucose 6 phosphatase was deficient, right?
Yeah.
All right. An infant with microcephaly, rocker bottom feet, clenched hands, and structural heart defect. What comes to mind? Microcephaly, rocker bottom feet, clenched hands, structural heart defect. What comes to mind?
I'm thinking about Edward
syndrome. Trisomy what?
It's trisomy of 18.
Trisomy 18, right? That would be trisomy 18. All right, a patient presents with jaundice. Jaundice and palpable distended non-tender gallbladder. Very important. Jaundice and palpable distended non-tender gallbladder. First of all, what do we call this? What do we call this?
How we call this? Jaundice, something that. What do you call it? It is. I don't know. Cholecystitis.
Cholecystitis. Not quite cholecystitis, but you're close.
Cholelithiasis.
Cholelithiasis. Yeah. Not quite cholelithiasis. Cholelithiasis is not without pain. This is Covacia sign, right?
Oh,
Covacia sign. What causes Covacia sign? Obstruction of the biliary tree. Usually it will be the distal obstruction of the biliary tree. What could obstruct the biliary tree distally? Pancreatic cancer. Not just any pancreatic cancer. At the head of the pancreas. They have cancer at the head of the pancreas. Do you get that?
No.
You have Covacia sign. Classic. Sometimes it's described as painless jaundice. Painless jaundice. You get that?
Yeah.
All right. Then we have someone with large rash. A large rash with bull's eye appearance.
Bull's eye.
Large rash
This
with
is
bull's eye appearance. Yes.
This is Lyme disease.
This is Lyme disease. What do we call that rash? Okay. This bull's eye is also described as erythema chronicum migrans, right? Erythema chronicum migrans. Bull's eye rash. How do we treat Lyme disease?
We treat with doxycycline.
Doxycycline. What did we say was the mechanism of action of doxycycline?
Doxycycline, it is
Mechanism of action of doxycycline. It's a tetracycline. We've already talked about tetracyclines.
Doxycycline is no, it's not that. 50.
No, again, it is not 50S ribosomal subunit. They bind 30S ribosomal subunit and inhibit what? Aminoacyl tRNA. You have to say this out loud to yourself so you actually memorize them. They bind 30S ribosomal subunit, inhibit aminoacyl tRNA, and prevent protein synthesis, right? That is what doxycycline, tetracyclines as a whole will do. What's their side effect we mentioned?
Discoloration of the teeth.
Discoloration of the teeth, photosensitivity, inhibit bone growth, teeth growth, right? So, contraindicated in pregnancy as a result. Does that make sense? What was the mechanism of resistance against doxycycline or against tetracycline?
Uptake effluents.
They obtain efflux pumps from plasmids, right? With the help of plasmids in the environment, and they increase efflux and reduce influx of the medication. Do you get that? So we use doxycycline. When you do step 2 CK, you want to know, okay, if what if they already have heart disease or heart involvement, other forms of Lyme disease, and how you treat them, etc., so on and whatnot. But for your step one, it's not important. Do you get that? So now, for now,
Yeah.
you treat Lyme disease with what? Doxycycline. Remember that the causal organism is Borrelia burgdorferi, right?
Yeah.
Borrelia burgdorferi, and of course, it's the ixodes that transmit it. You remember another disease that is transmitted by this same ixodes?
Yeah. The other one is no, it's not like I don't remember.
That'll be babesiosis, right? Babesiosis, babesia. They will have hemolytic anemia, just like people with malaria, right? They'll have hemolytic anemia, just like people with malaria. Do you have any questions?
No, I need to review.
All right, let's finish up with this guy. If they give you a child or a teenager or even an adult, someone with lucid interval, when you hear the word lucid interval, following traumatic brain injury,
I'm thinking about
lucid
epidural.
interval, epidural hematoma. Very good. And it's usually due to a lateral blow to the head, right? A lateral blow to the head will result in epidural hematoma. What blood vessel is damaged in epidural hematoma?
The meningeal
The middle
middle.
meningeal artery. And when you do CT scan, what do you see?
This is convex. I don't know.
Convex lens shaped lesion, right? Lesion. All right. What structure is damaged in subdural hematoma?
That is the veins, bridging veins.
The bridging veins. The bridging veins are damaged in subdural hematoma, right? And when you do CT scan, what do you see?
This is the opposite.
Crescent
Mm-hmm.
kind of shape. All right. And that is that. You want to remember that.